Today we're going to talk about skin rejuvenation. I want to tell you about the different techniques that are available today to help your skin look a little bit better. And when I mean better, we're talking about the texture, the tone, the wrinkles, the brown color, the red color, and there's so many different methods out there today. However, there's really a gold standard today. In my opinion, what that is plasma. Before I discuss with you what plasma means, let's sort of take a step back and look at the history of skin rejuvenation. About 13 years ago, there was a product called the carbon dioxide laser, or for short, the CO2 laser, which really has provided wonderful rejuvenation for the skin. But in my opinion, there is a high risk to benefit ratio, which really is, in my opinion, not worth going through. The carbon dioxide laser, for the first few days, there's sort of weepiness, discomfort. There is about a 3-month period of time where you have some redness that takes a while to go away. That's a tremendously long recovery period. And over the past 13 years, we've really seen that every year that goes by, you lose skin color. And to me, that really is not a very safe treatment option, in my opinion. The other technique that's sort of the strong technique that would give you about a week of recovery period would be a trichloroacetic or TCA peel at the physician strength level. It's a very good technique. I've done that for many years, but in my opinion, the problem with the TCA peel is that it truly doesn't take care of the fine wrinkles, the deep wrinkles, the texture and the tone. It's really for some color changes that are improved, but not a significant improvement in many respects, especially for patients that have medium to thicker skin and really imparts almost no benefit. So the evolution that I have now is more toward the standard, in my opinion, called plasma. What plasma does essentially is it allows you to get a rejuvenation that's very comparable to the CO2 or carbon dioxide laser, simply without the downtime, without the risks, and with a recovery time that's very similar to a TCA peel of about a week or so. It is a remarkable rejuvenation that takes about a year to fully be appreciated, but every week and month that goes by, there's ongoing improvement in your skin texture and tone. The recovery time is about a week. You will not look good that week. There's no discomfort, there's no pain with that afterwards, but for the first week, you will look a little bit red, and just like a TCA peel at the physician strength level, for the first couple days, your skin is intact, and slowly it begins to fall away. And for someone that has significant sun damage, I really think it's the gold standard out there today to really take care of patients with a lot of photo damage, a lot of sun damage. And it's really a magnificent tool that I have. What plasma means, for those people that don't understand what the word plasma is, it has nothing to do with blood. There's a term plasma for blood, but plasma is a fourth energy state, which is an excited nitrogen gas. The nitrogen gas basically bombards the skin and provides a wonderful level of rejuvenation. The thing to understand about plasma is that there is downtime. It is also very uncomfortable if it's done awake. The nice thing about it is I'm able to take care of you while you have some degree of sedation, known as conscious sedation, since I have a surgery center. That's very important to me, that you really have no discomfort during the procedure itself. There are other options for people that don't want to have the downtime, and we're going to talk about those options in a moment. The other thing I want to sort of touch upon is the recovery, because everyone wants to know, well, how much time do I have to take off from work? What do I have to experience? What is the cleaning regimen afterwards? I'm not going to get too much into the nitty-gritty today, but I do sort of want to present to you a general idea of what to expect for the week after. As I said, you won't have any discomfort, but you will not look good that week. You're going to have your old skin start peeling away. And during that healing phase, it's very, very important that you wear a thick coating of Vaseline in order to support the skin as the new skin develops. And I'll really walk you through that, because you may be uncomfortable in terms of what changes are going on. I see you several times that week just to answer your questions, review with you the care instructions, and really make sure you understand how to take care of your skin. It does require a couple times a day to clean the skin with some vinegar and water, and then Cetaphil cleanser. And then you have to put the Vaseline back on to really help keep that skin and really help it really heal very well. After about a week, your new skin is really formed, and at that point you may have a little light pinkness that may linger for about a month or so, and that light pinkness is pretty much coverable with makeup or camouflage. So the recovery is about 7 to 10 days, and you really need about a week off from work to get you where I think you would be socially acceptable to get back to work. Let's talk about other options for people that are not really interested in having a week of downtime. Really what I found to be incredible is a technology called Pixel, P-I-X-E-L, sort of the same thing you may be familiar with in terms of digital cameras and things like that, but it just has nothing to do with digital photography. What a Pixel treatment involves, it's an erbium laser. This is a laser. The plasma is not a laser. It's, again, excited nitrogen gas. And what the Pixel does is it causes micropunctures in the skin, so that all the skin doesn't go away like the plasma, but it's a little micropunctures that you barely can see in the skin. And that is a period of anywhere between 1 day of downtime up to about 5 days of downtime. But you don't need to do all the Vaseline, and you can cover it with makeup after a period of 1 day if need be, or camouflage for that. And usually if you're doing something that requires about 5 days of recovery time, that would be a stronger treatment. You need 3 of those treatments usually to get you the results. And if you're looking for something that requires a little less downtime, like 1 to 2 days, you may need about 5 to 7 mini treatments to get you there. The Pixel is really good for fine lines, for people with some early skin changes of aging that may not want to go through the recovery time for the plasma. I usually use that in combination with other treatment methods, for example, photofacials to manage color. I think photofacials really have been oversold. Many people try to look at a photofacial as a way to rejuvenate the skin. In my opinion, it's really specifically aimed to take care of color. And I've got different photofacials to help with color as support. I also use infrared skin technology to help tighten the skin. I've also got mesotherapy, which is a type of injectable into the neck or into the facial areas to tighten skin. So I've got a lot of different treatment options. I'm not here to really give you a full consultation on the video, but just sort of introduce to you that I've got the full spectrum of great technologies out there. They're really cutting edge, from something that requires about a week of downtime, something that takes maybe 5, 4, 3, or 2, or 1 day of downtime, and then I've got some options really where you don't even need any recovery whatsoever and you can go back to work the same day. I hope that's a good explanation for some of the technologies that I have available for you.